those are the measures that have been put in place here in Pinellas County. And some of the measures in Pinellas County that have been put in place is the beach closures. And the beach closures, along with pool closures, along with everybody staying at home, it's a combination of all of that. And kind of an overview, and I'll turn it over to the county administrator, and then we'll take your questions.
Good afternoon. So I think the discussion that occurred with commissioners was at an emergency meeting on Monday. And really what prompted that is that the commissioners are hearing, a lot of residents' concerns about not being able to use their condo pool, or not being able to go for a walk on the beach. And in fact, we have thousands and thousands of pools. And so there's probably no doubt that there are a lot of residents that are responsible, and in your particular condo building, you may not have a problem with large gatherings if you did reopen the pool. But in many instances, and we have proof through footage that we saw during a couple of weeks ago, that in fact that's not what was occurring, and that there were large gatherings, large parties, and groups of people going on as business as usual, which took us to the step of closing all the pools. Same thing with on the beach. Again, we do not at this point need to go backward to look at how or what would occur if in fact we loosened up on these restrictions. The restrictions are in place. These are consistent with almost every other part of the country, and in fact, we're seeing that large climb in the number of cases decline. Hopefully we'll be there soon to where we see this begin to go down, but that's not today. The commissioners want to see us put measures in place to be able to have that conversation of when would we loosen up and look at restrictions. So we're going to have that, and we're going to talk about that on Thursday. We're going to show them data to show the projections that we've been working with our health professionals to create, and also talk about the types of measures that at the right time we could put in place that would ease up on some of the restrictions, but that would not lead to community spread and dragging this out longer than it needs to occur. So that was kind of the discussion on Monday. I think it's a good discussion to have, and we'll continue with providing information in a public forum to have those types of discussions.
So I just want to add this before we take your questions. Think about it this way. And we don't need to look at the past. We need to look at where we are today and where we need to be moving forward. And think about this. Use sickness as an analogy. Is that if you're sick, you got to decide whether you're going to take the medicine. And if you're sick and you decide to take the penicillin, you don't stop taking the penicillin halfway through the cycle of the prescription. You finish it all the way through. And that's where we are today, is that we are in the middle of this. We can't now just stop it, because if we stop it, then we're going to get worse than where we were before. So think about it that way. We've got to finish the prescription. And how long that's going to take, we don't know. We do know that Florida will be at a pivot point at the end of this month when the governor's safer at home order expires. And based upon all the best information that's available to him, I'm sure he'll make the right decision and the best decision. And he's going to have to decide whether to let the order expire, whether to craft a new order with different parameters, or to extend the current order. And that's still about 2.5 weeks away. And as hard as this is to put our arms around, remember that we are only 10 days into the governor's safer at home order. The first couple of days of it was a weekend, so I'd really suggest to you we're only about 1 week into it. That's not very much time, even though it feels like it's a lot longer for all of us. So why don't we go ahead and take your questions? What's the first one we got?
Sure. If you were opposed to closing the beaches and said people were maintaining proper distance, but now you're opposed to reopening, could you clarify?
Yeah, so like I said, I'm not going to go back and visit the past. I had the position that I did then, and at that time, my position doesn't change and hasn't changed. But that ship sailed, that decision was made. And I think then there was an opportunity for intermediate measures before we went to the extent that we did. But now that we're there, you can't go back and unring that bell, and you can't go back and undo it. And from a management standpoint, from an enforcement standpoint, from people knowing what the rules are, we can't keep moving people back and forth. Is that you have to remain consistent with it. So my view hasn't changed from where we were at the time, but that's the past, that's history, that ship sailed. We're not there anymore. We are facing with what we have today. And I'll say the same thing when the county enacted its Safer at Home order. Our Safer at Home order here in Pinellas County that allowed businesses to stay open, it worked. And the data shows that it worked. And in the 1 week that we were operating under the Pinellas County Safer at Home order, which allowed businesses to remain open as long as they practiced CDC guidelines on social distancing, we had deputies out there. And in a 1 week period, we conducted over 4,000 checks of businesses. Think about that, 4,000 checks of businesses. We are looking for violations, and we could only find violations in less than 1% of the cases. And then a week later, and he has the absolute right to do it, the governor said, nope, we're gonna shut everything down. And we saw what we had in place here working, but now we're under the stricter guidelines. So we're gonna live by those stricter guidelines. We don't go back. Those ships have sailed. And we can have our views about what was done or not done, but that doesn't help us at all to go back and have that discussion again.
Are there any plans to follow suit with Hillsborough County and institute a curfew?
No, there's no reason for that here in Pinellas County. I talked to Sheriff Chronister over there. They had some very specific problems. I know why they did it over there in Hillsborough County, but as far as I'm concerned, there's no reason to do it. I don't know if the administrator wants to weigh in on that, but I see absolutely no reason to do it here in Pinellas County.
Now, again, from the Hillsborough County standpoint, they did it for a specific reason. The sheriff says we're not having those same issues, so that is not something the executive policy team has discussed.
Why are boat ramps, marinas open, but boat clubs and kayak rentals closed?
Well, if you go to the whole idea is if you have your personal boat, you're out on the water with your family, your one family unit. When you open rental places, now you've got people coming in, touching the boats. It's the same thing as any of the business closures and why you close businesses. So those are same as any type of retail operation, unless it was specifically authorized within the governor's order as an essential service, then it's deemed closed and therefore they fall under that.
If I see people violating the order, can I notify the sheriff's office on your Facebook page, or what's the best way to notify you?
Best way is to call 727-582-TIPS. Again, that's 727-582-TIPS. Call that number. That is our call center, and it is staffed 7 days a week from 7 o'clock in the morning till 11 o'clock at night.
Sheriff, where do you stand on requiring residents to wear masks like Hillsborough County?
I don't support that. I think that people want to do it on an individual basis. One of the things that everybody needs to have a clear understanding of is what the masks do and what they don't do. And I think there is confusion about that, and a big believer in making informed decisions. And if it works for you, I have no problem with it and would support people making that individual choice. But here's what you need to know, is that there are different types of masks. The only mask, and you really can't get them, the only people that have them are the first responders and the healthcare professionals, and those are called the N95 masks. And to the extent that anybody has them, they have 1s and 2s out there. But in mass, you can't get them. The N95 is the only mask that is going to protect you from acquiring the virus. So if somebody coughs or sneezes, or you touch something and then touch your face, etc., the only thing that is going to keep that away from you is an effective barrier is the N95 mask. All of the other types of masks, the surgical masks, the KN95, and a couple subsets of those, or somebody taking a piece of cloth and making their own mask, the only thing that that's going to do is prevent you as a carrier from transmitting the virus to somebody else. So if you're wearing the cloth mask that you made from material you got at the cloth store, if you are wearing a surgical mask, if you're wearing any other type of barrier on your face, that is going to protect others from you, but it is not going to protect you from others and from receiving or acquiring the virus. And I think it's very, very important that people understand that distinction, because people should not be lulled into a false sense of safety and a false sense of security that then diminishes their efforts at social distancing. Because if you're wearing that mask and you think, well, I've got a surgical mask on, I've got a cloth mask on, I ripped a t-shirt, as I've seen people do, and wrapped it around my face, well, I can pretty much go anywhere and do whatever I want because I'm protected. That is just simply not the case. So if people want to do it, that's fine. But as far as making people do it, I don't support that. I think it has to be an individual decision. But what people need to know is that if they are doing it, unless they have that rare N95 mask, they themselves are not protected, and they need to take the exact same precautions they were taking without a mask. And the only thing the mask does, again, is prevent them from transmitting it to somebody else if they are a carrier.
Where can I get some kind of hotel help to get off the street? The shelter is closed and I'm currently sleeping outside.
I would encourage you to call 211. So we do have resources available, and 211 would be able to connect you with resources for your situation.
Why is the ban on vacation rentals not being enforced? Why do you think the governor extended it until April 30th?
Well, I don't know that it's not being enforced. It is that the order is being enforced by the State Department of Business and Professional Regulation, or DBPR. And it expired last Friday, late in the day, about 5 o'clock. The governor did extend it, and he extended it to coincide with the expiration of a safer at home order. And so that's what he did, but it's not a situation where it's not being enforced, but it's being enforced by the state, and they're the ones that are conducting investigations into that. It's also very difficult to enforce, quite frankly, because there are certain parameters and certain limitations and certain things that are allowable under the order, and you have to have access to certain information to make determinations about the length of the rental, etc. So that is something that people should, as it's stated in the order, report to the state, and the state will handle that.
Explain how Pinellas County determined that standalone vitamin and supplement stores are non-essential.
So Pinellas County didn't make that determination. The governor did, and he did in his order. So remember, is that the state order, the governor's order, says here are essential services, businesses. Here are essential activities, recreational activities, going to church, etc. So you have essential services and you have essential activities. As to essential services, they included roughly a 6-page guidance from the U.S. Department of Homeland Security regarding the workforce. And they included orders from the Miami-Dade County mayor in his orders in South Florida that identified essential services and said, here you go, the rest of the state, here are the things that are essential. Everything else is non-essential. So the governor's order doesn't list essential and non-essential, is that it includes from those two documents what is essential and has excluded everything else. And simply, vitamin stores are not essential in the governor's order, so therefore they are not essential, and people are prohibited from leaving their home to travel to a store for the purpose of purchasing vitamins.
Looking forward to when any potential stay-at-home orders would be lifted, is there any plan in the works for gradually reopening businesses, or is it just going to be the orders lifted and we're back?
That's something that we're looking at now, and I think that really is the reason for the commissioners wanting to have that type of conversation. We're going to begin to have that on Thursday with the commissioners, and the idea is we're looking not only at the metrics in terms of the graphs, but at what point would we then see gradual declines in some of the restrictions. That's also dependent upon the governor and how he whether he lifts his order or not. We're also watching what other states are doing. You saw in the paper. Different states looking at different ideas on how to reopen the economy. So we're looking at all of that. We're going to try to make that a data-driven decision, provide some of the metrics to the commissioners, but part of that will be looking at the things that we have here locally, and then also what the state does from the governor's order.
When do you anticipate seeing the peak of the virus in Pinellas County? Is there updated data on that?
Well, I said that in my opening, is that the best projection we have right now is April 26th. But again, that's a fluid number, fluid time frame, and it depends upon ongoing analysis. Remember, April 26th is when it's projected to peak as far as the number of cases are concerned.
And if you look at that, let's think about that. The peak is hospitalization use, and that's April the 26th. That's a projection, and it changed even over the weekend. It changed from April 21st to April the 26th, and that's these models that they're using, or healthcare professionals are using. But what that also says, though, is that it'll occur on April the 26th, but it won't be back to what it is today in terms of COVID-related hospitalizations until June the 1st. And so, we're looking at these measures to try to bring some of the data to say, okay, at what point when we see that decline, is it appropriate to lift some of these restrictions, go to social distancing practices? But that's a reason we need to bring that together with the information, to see where the governor's headed as a statewide order to try to make some informed decisions.
Sheriff, how has this affected hiring, specifically like for deputy recruits and the recruit process? Are classes on hold?
Yes, everything's on hold right now. We're not doing any hiring at all. We do have some recruits that are in the academy. The academy is not in session, they've closed. So they're here working around the sheriff's office. We have people that are in field training, etc., but all of our hiring is stopped at this point.
Why did Pinellas County close car washes, and is that not considered essential? Other counties have deemed car washes essential.
Well, I think the sheriff, kind of answered that in that we didn't close car washes, the governor's order did, because it did not list car washes as an essential service. Now, it's very valid to raise those concerns. There are counties in the state that deem car washes not essential, and they're closed in this state. There are other things that we have interpreted differently than other counties that are more relaxed. So this was a very broad order. We had a short period of time in which to interpret it and apply it. We've tried to do that consistently, but those decisions were made, and that's where it's at. That's the way we interpreted the order.
How, if at all, is this affecting some of the typical preparations as we roll into hurricane season?
I think our emergency management team is obviously activated. We're looking not only at the coronavirus and our responses, and also updating our sheltering plans and all the things we would normally do. They're trying to incorporate those into the daily planning. So there's a lot going on. We have to prepare for both the worst case scenario under the coronas, and also prepare for needs if in fact we have inclement weather.
Sheriff, how has this affected crime rates? Have you seen an increase, decrease? Are you concerned about whatever the trend is continuing? Should this continue?
If anything, it's down slightly. Pretty much I'd say status quo. And I'm not seeing anything that gives me any concern. We had some indications, but it's more sporadic, that people are getting a little cabin fever. We have not seen a huge uptick in domestics. That's one of the questions that people often ask. We'll continue to watch it, but Pinellas County remains a very safe place. Overall, the majority of people are doing the right thing, and we appreciate that, and ask them just to keep doing what you're doing, and we will all make it through this. So I think that's the last question we have for today. We will be back with you again on Thursday, the 16th, a couple days from now at 5 p.m. To again give you an update as to where things are and take your questions. So we'll see you on Thursday at 5 p.m. and thank you for joining us.